Still waiting, 10 seconds maybe. All right, we're live in 3, 2, 1. We're live.
Hello and welcome to Wellness Live. Thank you so much for joining us. My name is Dr. Olivia Moses and I'm the Executive Director for Corporate Health and Wellness here at Loma University Health. This broadcast is brought to you by the Living Whole program in the Department of Risk Management. I am so excited to be talking to you today, and all of you, wherever you are watching from, are probably starting to get back to life, and hopefully we are getting out of this whole COVID pandemic change that we've gone through. We've had a lot of stress that has been in our personal life and at home. If you are in a corporate setting, you might be short-staffed, so emotions are high, everyone is being overworked. We are in a scenario now that we're still feeling the effects of COVID-19. So we here at Wellness Live, absolutely support mental health and say we need to have an active process to actually be healthy emotionally and mentally. So we have a wonderful guest for you today. She is a friend of the Living Whole program. She has been here at Loma University Health for 6 years. She is the director of our Employee and Student Assistance Program, and her name is Dr. Jana Boyd. We are thrilled to have Dr. Boyd with us today to talk about emotional safety in the workplace. She deals with our employees, she deals with our students. This is the perfect person to talk to us about this topic. So please join me in welcoming Dr. Jana Boyd.
Thank you so much, Olivia. Happy to be with you.
Well, you can go ahead and take it away and maybe start your presentation.
Okay, I will do that. I'm going to go ahead and share my screen here. So emotional safety in the workplace is kind of a newer topic that I started to really think about recently. We do a lot of talking about physical safety. We do trainings here at Loma on what kinds of things we need to do to keep our workplace a safe environment. But we don't often talk about the impact of how we feel interpersonally with our coworkers, how we feel protected or safe by our environment or our teams or the organization itself. And so I feel like this is a topic that I'm noticing might be relevant for not only people here within Loma but oftentimes, in any work environment you're in, there's going to be factors that are going to contribute to how safe or unsafe you feel. Here at Loma EAP, I will have employees come to me, and they come for all kinds of different reasons, whether it's interpersonal reasons or family reasons or just mental health in general. But sometimes I'll have people come in and say, I really love my job. I really love what I do, but I feel so stressed at work. And I feel like I'm not able to speak up about the things that I'm struggling with. So when those things kind of happen, I'm always very curious about what is it that makes this person in particular feel unsafe. Because what we find is that you can have people on the same team where one person will feel very safe and someone will feel very unsafe. And so we really want to try to understand what are some of those factors that might contribute to what makes someone feel safe or unsafe. So I went to the organizational psychological research to get some ideas about what might be some of the factors that we can pay attention to. So we're going to be reviewing some of that literature and see if there's some things that we can take from that can help not only for us to feel safe, but for us to be able to contribute to our environment so that others can feel safe as well. So we're going to be starting to look at just a definition. So in the organizational and behavioral psychological literature, they have a term psychological safety, which is what we're going to be kind of focusing on here. And it's a very narrow definition, and it has to do with how safe do you feel to speak up in your environment. And so there's a couple different definitions here. Being able to express your true self without fear of negative consequences. And the belief that the work environment is safe for interpersonal risk-taking. So again, that's that sense that it's okay to be yourself, that it's okay to ask for what you need and to have a voice. So that's what we're going to be focusing on. Now, there's lots of research that demonstrates why this is such an important thing. First of all, if we are feeling safe, we're not feeling stressed at work. And we know that stress has all kinds of negative effects on our mental health, on our physical health. So this is huge to know that you can go to work and you're going to feel safe. It improves our employee wellness. This is a big issue for Dr. Olivia Moses, that we want our employees to feel healthy, spiritually, physically, emotionally. If you're feeling good about your work environment, you're more likely to stick around. You're not as likely to go and find another job or transition out. So it's good for the organization, for teams, to have that stability if people are really feeling safe to be there. We also have increased engagement and quality improvement, which again is so important for an organization, that we want to be always learning and growing and doing things better and improving our processes. And so if people feel safe to speak up, they're going to be able to provide the information that you need in order to make sure that we're becoming a better organization, that we're doing things better. And ultimately, here at Loma Linda, we care about our patient outcomes. And so we're going to have better patient care if people feel safe, they feel that they can speak up, and they feel that they're invested in the well-being of the patients as well. So there's three different levels that we're going to be looking at. So there are our organizational factors, there are team factors, and then there are individual factors that have been identified in the research that contribute to the overall experience of emotional safety for our workers and for us as individuals. So looking at the organizational level first, the kind of the overarching definition that we talk about being able to speak up is that, are there policies that allow people to raise concerns in private? Here at Loma Linda, we have compliance hotlines where people can call if there are concerns. We have an electronic reporting system where people are able to submit reports. And although these things are not perfect and there can be challenges with them, but as an organization, research demonstrates that these are really important factors in making sure that employees feel safe, that there's somewhere that they can speak up if they're having concerns. A negative culture, non-inclusive or blaming. And I think this is true of any organization, that when you have kind of systemic factors like shift work, for instance. So if you have, nurses that are doing the same job kind of around the clock, there can be that sense of, if someone is sort of not pulling their full weight, there can be frustration and blame when it feels like, they're not doing their work. And so then I feel like I'm having to do more work. And that can contribute to kind of a culture of blame. Also in healthcare, we work in such intricate teams where you need a lot of people to be really doing their job in order to be able to accomplish the task together. And so again, it kind of sets up systemically the potential for increased blame, because you are so reliant on other people to be, again, pulling their weight equally. And when they're not, then, there can be that frustration. And so that's something that can really make you feel not safe. If it feels like, if for any reason maybe I'm not feeling good, or I have a lot going on interpersonally at home, that I'm not able to pull weight as much, am I going to be receiving more blame, or am I going to be receiving understanding and compassion when I'm struggling? The other factor at the organizational level that has been identified is a strict hierarchy. So the more there is sort of this sense of, people at the higher levels of the hierarchy are able to speak up, and people at lower levels of hierarchy are not, then that's going to be a very less safe environment, particularly for people at the lower levels of the hierarchy. So the more that, and we'll speak about this more, the more that people at higher levels of hierarchy really seek to flatten that, so that everyone feels safe to speak up, is a really important factor in creating a safe work environment. At the team level, we really see the role of leadership being just huge, because the leader does so much to set the culture and the tone for the teams that they are providing the leadership for. So leaders need to be very inclusive and welcoming of all the people on their team. And this is kind of a specific skill set, because we're all kind of biased to relate to the people that are most similar to us. And so when there are people that are very different from us, sometimes it can be a challenge to really reach out and welcome them and bring them in, and so that everyone is feeling really welcome and included and valued on a team. Expectations are really important. And sometimes this is hard because leaders don't always, because our roles and leaders can sometimes be very different than people that are lower in that hierarchy. And we don't always know if the expectations that we're having of them are realistic unless they speak up and inform us about whether our expectations are realistic for them or not. And so you can see why it's so important that people at the lower levels of the hierarchy feel very safe to speak up, so that they can make sure that people in leadership are setting the expectations realistically. And then finally, lack of familiarity and support. So here we see how important relationships are, right? So if you know that the people on the team know about each other, we know about about your families or your hobbies, food preferences, just all those kinds of little details really help us to feel more familiar and safe with people, as opposed to feeling like this is a complete stranger that I'm working with that I don't know much about. So we see that relationship plays such an important role in this experience of safety. And then finally, at the individual level, there's a lot of factors here, but back to relationship, the lack of familiarity. So the more you know your coworkers, you know your leaders, you have that interpersonal connection with them, the safer you're going to feel. The negative prior experience is a big factor. So if you find that you have had previous experiences where you've spoken up because you were concerned about something or you're struggling with something, and if you received a negative response or no response, and research shows that either one of those has an equally negative effect on the likelihood that that person will speak up again if something comes up for them. So, so yes, if you've had an experience where you've spoken up or you've tried to have a voice and that was not received well, or there was no response at all, you're less likely to speak up again in the future. Low sense of work confidence, knowledge deficit. You can see how people who are new to a job, who are just learning the job, are going to feel less safe than someone who has been there for a long time. So the more that we're able to feel confident, that we feel like we're good at what we do, the safer we tend to feel in our jobs. Back to the hierarchy issue, low in hierarchy. So if, and this is interesting, the research showed that people tend to underestimate the role of hierarchy and how safe they feel to speak up. A lot of times people will say, well, I'm just the type of person that I speak up more, and I don't know why these people don't feel safe enough to speak up. But there's a lot of reasons that indicate why you might be higher up in the hierarchy and not even recognizing what a huge role that plays and how comfortable you feel to speak up and just feeling emotionally safe in general. And then a high workload. If it feels like, what is expected of you is more than what you can accomplish, understandably, you're not going to feel very emotionally safe, because you're going to feel like, maybe I'm not going to meet my leader's expectations, and then maybe they're going to be frustrated with me, and maybe I'll even lose my job. So having an appropriate workload is so important. I want to talk a little bit about the insider versus outsider dynamic, because, excuse me, we are tribal creatures by nature, as much as we would like to try to be different than that we just have this human tendency that because this world can be a stressful place, that we feel much safer if we feel like we belong to some group, right? And then what comes with belonging oftentimes is a sense of who belongs in the group versus who does not belong in the group. And so in any kind of a human kind of setting, which we're all a part of, obviously, it can be very challenging to welcome in outsiders into the group. And sometimes we have these sort of, I don't know, almost like hazing rituals that we go through to incorporate people into our groups, which can be extremely stressful. And we're going to talk a little bit more about some of the factors that maybe make this a particular challenge here at Loma Linda. And if you're not a part of Loma Linda, you might be thinking about what are factors that sort of help determine who is an insider versus who is an outsider. Now here at Loma Linda, in some ways we are a little different than potentially some other organizations, that I think there are maybe even more levels that determine your sense of belonging versus being an outsider. And I want to go over those just a little bit, just to kind of highlight some things that maybe we need to be more aware of in terms of what we assume makes us an insider versus an outsider. So here at Loma Linda, we're a Seventh-day Adventist organization. So being a Seventh-day Adventist automatically gives you a level of insiderness at Loma Linda. Now, we have a large number of employees and students here at Loma Linda that are not Adventist. And I hope that they still feel a sense of belonging, but that can be sort of an automatic layer of insiderness, I guess I would say. So religious affiliation, education or work experience in the Seventh-day Adventist system. So Adventism has a very rich education system. So for instance, you can go to an Adventist school from kindergarten all the way through graduate school. And there's a lot of interconnectedness that comes with those experiences of education. If you're working with Adventist institutions, with churches, schools, hospitals, there's again a sense of interconnectedness that can come with that. Here's with Loma Linda, right? I was talking with someone recently who is not an Adventist, but has been here for 30 years and very much feels a sense of belonging, which again, that just comes with the experience of being in a place for so long and developing those relationships over time. Your place in the hierarchy, right? The higher you are in the hierarchy, the more of a sense of belonging you have. So even if you come to Loma Linda as a non-Adventist who has never worked with an Adventist organization before, but if you come in at a leadership level, you're going to feel more of a sense of belonging than someone who comes in at sort of an entry-level position. Race can play a role, as we know in all organizations, gender, sexual orientation or gender orientation. So all of these layers really contribute to how much of an insider we feel at Loma Linda versus an outsider. And if you are an insider, there's no better place to work. And if you're an outsider, there are some challenges that you can face. And I want to just highlight the importance of why it's helpful for us to really listen to people at those bottom levels of the hierarchy or who come into an organization as an outsider, because they do provide a unique perspective than someone who comes as an insider. It's almost like, when something's very close, we can't see it very clearly, but when it's a little bit farther away from our eyes, sometimes, well, for me, if I'm farsighted, then it's easier to see those things. So outsiders and people at the bottom of the hierarchy really provide valuable information that we need to really take into consideration and make sure that we're able to hear those voices. So they're able to report on the status of the emotional safety in the work environment. We might feel like, because of our experience, like, oh, this is the safest place in the world. But for somebody else to come in and say, oh, actually, no, I don't always experience it as a safe place. We need to be able to hear those voices so that we can address what might be some of the factors that make it feel unsafe for people in general that are coming in as outsiders or lower on the hierarchy. They also bring a new perspective for process improvement. So, having someone come in from the outside and say, we did this differently over here, and I think it was a little bit more efficient than the way that we're currently doing it here at Loma Linda. That's really valuable feedback for us to be able to learn and grow. And then finally, people, again, at the lowest levels of the hierarchy are most affected by systemic problems. So if there are cultural issues, if there are policy issues, if there are workload expectation issues that we're not aware of because we're not being as impacted by it. We need those people to be able to give us that kind of feedback. So I'm going to pause here and throw it back to Olivia if there are any questions or comments that we want to address at this point.
Well, thank you, Dr. Boyd. We do have some questions coming in, and if you are watching us live, this is a great time to interact directly with Dr. Boyd. So first question, how does remote work environments impact psychological and emotional safety?
That is a great question. From our perspective here at EAP, we see both costs and benefits. So one of the costs is the isolation. Right? That for some people, it has been very difficult to not feel like they're able to interact with people as much, that they're not getting that sort of energy that you can get when you're interacting with people. And so it has been very difficult for some people to be more isolated. And we see higher levels of anxiety and depression associated with that. On the flip side of that, we're also seeing some positive benefits in terms of people feeling like there is more of a work-life balance. so that they're able to, during their break, they're able to, check in with their kids, or they're able to, do a load of laundry or something like that. And so, or they're not losing as much time commuting to and from work. And so they feel like they just have more time available to them than they did when they were working from home. So that's definitely been a benefit. Going back to the challenges again, one of the difficulties that we're seeing is it's a little bit harder to separate out personal time from work time. They can kind of bleed together a little bit more. So, some people are very good at maintaining those kinds of boundaries, and it's more challenging for some of the rest of us. So those are some of the things we've observed.
Perfect. We have another question that has come through, and is, what are the risk factors for psychological and emotionally unsafe workplaces?
What are the risk factors? Well, I think kind of reflecting back on what I shared earlier, if you are new to the organization, new to your job, you are more vulnerable because you are just under a more stressful situation at that point. If you are feeling less competent in your job, and the hard thing is there can be things out exterior to your work environment that can contribute to your level of competence. So, maybe you've been working in a job for a while and you're feeling really good about it, but all of a sudden you start having some challenges in your personal life. Maybe you're having some health problems, or maybe you're having some marital problems, and all of a sudden it's impacting your ability to concentrate at work, that your energy level is not what it used to be, or you're becoming more irritable, so you're having more maybe interpersonal conflict with your coworkers. That's going to make you feel less safe in your work environment as well. So, and I know this isn't something we haven't addressed so much here, but things going on in your personal life that can impact how you feel like you're doing at your job, I think can make you feel more vulnerable emotionally in your work setting.
So, Dr. Boyd, what happens if what I define, let's say we work together, I define what is an emotionally safe place for me to be. You have kind of defined it for you, but they're not the same. And then there is a judgment between us that I'm too sensitive because I'm demanding more. How do you address those kinds of things?
Well, Olivia, that's a very challenging thing. And the thing that I'm struck with over and over is that we all understandably are living life from our own perspective, right? And so we tend to assume that everybody sees things the same way that we do, when clearly they do not, right? And so I think we have to be very gracious in recognizing that each of us comes to our work setting with very different but valid perspectives. And the more that we can be sort of, humble in recognizing that, and that we can dialogue with other perspectives about, okay, this is the way that it makes sense to me that it should be done, or that we should handle these kinds of complications, and really recognizing that people are coming at from very different perspectives, and we can't expect, we can't assume, we can't demand other people to come at from our own perspective. Obviously, these kinds of situations are going to be difficult to work through, to communicate around, and so forth. But I think having that sort of humble perspective of like, I recognize that I only have one view, and that other people are going to come at it from a different perspective, and I need to be open to the validity of their perspective.
Am I also hearing you say that sometimes it's okay not to understand, but to give somebody what they need?
Oh, absolutely. Yeah, absolutely. I mean, I think it always helps if we can understand, right? If we have the opportunity to really kind of hear from them where they're coming from and why, but sometimes we're not going to have that opportunity. And so I think you're right that sometimes we just have to give them the benefit of the doubt, even if we don't understand.
Great. So let's say someone wants to improve the emotional safety in their workplace, and we have our viewers that work in departments and that type of thing. Are there any simple things that we can ensure that we do to increase the safety in that department?
Olivia, that is everything that I'm hoping to talk about in the second segment here.
Well, perfect. Well, why don't we get to it then?
Okay, sounds good. Let me go back to sharing my screen. All right. So the question, how can we promote emotional safety in our workplace? That's what we want to focus on. And again, I'm going to go back to that organizational level, the team level, and end on the individual level. And as you think about your role in your work environment, you may recognize that that you are in a position where you might have the ability to impact things at the organizational level, or the team level, or the individual level. Obviously, we all have the ability to impact things at the individual level, but I think it's helpful to sort of think about your role, and if there are things at the team and the organizational level that you may be able to have some influence over. So let's start with the organizational level. And these kind of, reflect on the points that we've already talked about. So advocating for policies that allow for privacy and addressing concerns. Sometimes, like for instance, with our electronic reporting system, there are challenges, right? That if someone makes a report on you and you don't feel like you have the capacity to really defend yourself, that can be a really uncomfortable position. And I think that's something that we're always trying to address at Loma Linda, but recognizing how important it is to have those places and to really protect and just advocate for places that people can address concerns when they have them safely. Avoid being non-inclusive and blaming, encouraging others in this. So, if you see people being, critical and judgmental in ways that are just not productive for the safety of the team, if you are in a place of safety or even, leadership, to be able to speak out about those things. And I would hope that anybody at the level of hierarchy would, if they felt safe enough, recognize how important it is to really advocate for a safe culture. Seek to flatten the hierarchy from your positions to power. This is something we're going to be revisiting, because it seems to be such a huge factor in creating safety, is that if you are in positions of power, really seek to flatten it so that everybody at all levels of the hierarchy know that their voice is welcome. At the team level, notice and address lack of inclusiveness. Again, like we were talking about before, if you notice something, please speak up about it or find ways to address it. And leaders at all different levels in the organization, I think that is such an important part of their role, is to be paying attention, because these are things that will just show up, if people of color are not being able to have a voice as much as others, or specific genders, or even ages, right? Sometimes if we have a young member on the team, we feel like, oh, they're so young, they don't know as much. No, we really need to empower people at all levels to be able to have a voice. Provide or request clear expectations. Get to know your colleagues. Again, we're going back to relationships. So, with the Gallup poll that we just did here at Loma Linda recently, one of the questions that we always have dialogue about is the question about, do you have a best friend at work? And just coming from an EAP perspective, I don't necessarily see that as the best indicator of emotional safety, but what is really important is, do you know the people on your team? Do you know a little bit about them interpersonally? There may be even people that you don't feel like you connect well with, or even feel like you like, but you still need to have a collegial relationship with everybody on your team in order for it to be an environment that is safe for yourself and for other people. And then value adaptability and learning. I recognize this here on my team, that I always get asked, what is your process improvement goals and things like that. And part of me is like, oh, we're just doing our job. Do we always have to be growing and changing? But, but that is so important, to always be looking for ways to grow and change. And if we really value that, we're going to be seeking perspectives of people that maybe are coming in as an outsider or are new to the team, of like, what do you notice about what's working well or what's not working well? And then at the individual level, back to the relationships, getting to know your colleagues. Remember that things can be different. Before, I talked earlier about, if you have a negative experience of having spoken up and then either gotten a poor response or no response, that you're less likely to speak up again. But to recognize that circumstances can change, environments can be different. So even though maybe on one team you had a bad experience with speaking up, but a different team can be a very different environment, or a different leader can be a different opportunity to speak up. And so I always encourage people to don't give up and keep trying and keep talking to, if you have a bad experience with someone, go to someone else and speak up and still, try to have that voice, because it's so important for your well-being. Seek to become proficient in your job. Again, if you're feeling anxious because you're not doing your job very well, are there things that you can do to become better at your job? Can you ask for additional training or mentoring so that you can become a lot more confident in what it is that you do? Lift up others who are below you in the hierarchy. So, the number of years that you are here or the positions that you hold, if you are always thinking about, from my positions of privilege or power or whatever term we want to use, or just hierarchy, how are you really seeking to lift up and hear from people who are below you in that hierarchy? And then advocate for manageable workloads. And again, we've talked about earlier, if what is on your plate is more than you can handle, and I know that all of us feel that at one time or another, but speaking up about that and asking for adjustments if need be, or to be listening to other people's experiences and advocating to make sure that we're not overwhelming people, that we're not burning people out so that they're not able to feel safe. I did want to highlight my source material a little bit. So if this is anything that you have any interest at all, there are two articles in particular that I found really helpful that just came out last year. The second one, which is the presence of potential impact of psychological safety in healthcare settings. That one is a survey of all the quantitative research that's been done over the past several years to kind of build this model of what are the factors at the organizational, team, and individual level. And then the other one is why am I forgetting a qualitative study where they went and interviewed people in healthcare and really, listened to their stories. So both of them are really wonderful resources if you have an interest in this any further. And I'm just going to put this slide up just for if there are people within the Loma Linda system, if they are feeling stressed and needing additional support. I really hope that everyone is aware of the services that my office offers of free counseling for employees and students, and even family members of employees and students. And so we're just a phone call away. We provide remote services at this point. So I put in a plug, not because I'm looking for more business, because we are very busy, but I just want to make sure that everybody is aware of the resource that's available to them. So I hope that answers your question, Olivia, and I'm going to throw it back to you.
Thank you. And Jana, you and your team do just excellent work. And what you do is so very important. We don't have a lot of time, but we're going to get to maybe one last question here. And it feeds into another question. What are the real impacts on workers working in a workplace that isn't psychologically healthy or safe? Now, with that being said, that also says, when does it get to a point where maybe we need to start talking to other people or talking to someone to help?
That's a great question. Yes, when you are working in an unsafe work environment, it is going to take a toll on you. It will take a toll on your psychological well-being, on your mental health. It will take a toll on your physical well-being. We see all kinds of impacts of stress on our health. And so I always encourage people to really pay attention to just your functional level. If you notice that you are just not functioning at the level that you know that you're capable of. Some of the things that we tend to watch for is, is your sleep being impacted? Oftentimes when we're really stressed out, we're not sleeping in the normal ways that we do. Is your energy level lower than it usually is? Is your concentration lower than it usually is? How's your mood? Do you find yourself feeling more discouraged or more anxious than you normally are? Do you find that you are resorting to using different substances or unhealthy behaviors to cope with your stress? Is it impacting your relationships? Are you finding that you're having a lot more conflict at home or at work with other coworkers? These are all indicators that you're not functioning at your normal healthy place. And when that's the case, then I think those are all, it doesn't have to be any one, you don't have to have all of them to be an indicator that it's time to get help. But usually those are things that we encourage people to be watching for.
Well, thank you so much, Jana, for your time today. And we want to thank our audience as well and encourage you to think about your emotional safety, think about your mental and emotional health, and really get help when you need it. Just like we go to a doctor for our annual physicals, or when we have, pain and aches and, we have trauma to our body. This is the same thing with mental health. We have professionals out there that can really change your life, help you change your life. So just want to emphasize that. And again, thank Jana for being here. I also want to invite you to our next Wellness Live. If you have heard that nuts are good for your health, you are going to love our next presentation. It will be on May 26th here at noon Pacific Standard Time. And we have Dr. Sujatha Rajaram talking to us about how do we get nuts about healthy aging. So you don't want to miss that presentation. We want to invite you to join us. So thank you for joining us